Hi, everyone. Thank you again for joining me. My name is Dr. Bill Owens, and I'd like to take a little time today to talk about the concept of evidence-based. Now, we hear a lot about evidence-based this and evidence-based that, and those words are really thrown around. Is it evidence-based? Or I practice in an evidence-based environment. And to be truthful, with all of my experience at the medical school, working with family practice residents, working at the 3 chiropractic colleges in the postgraduate world, and doing these videos and doing online conferences and traveling and treating, I found out historically that a lot of people throw those buzzwords around. However, they really don't understand what they truly mean. And when we as providers don't really truly understand what those concepts mean, they can sort of be twisted and morphed into a concept that fits the needs of other entities. So what we want to do is educate ourselves. And I went through this process, and I'm hoping that this short little video helps you to just be educated enough so that you start to seek out more information. None of these videos are designed to give you everything, but I want to sort of give you, just like what happened to me with my mentors, give you a little bit of an awakening and realize that there's a concept, and then that concept can build on other concepts. And that's how we evolve as a profession. So today we want to talk about evidence-based care. Evidence-based care is comprised of 3 different entities. The first entity is the doctor's experience. I know when I got out of school that I knew a little bit less about clinical practice than I do now 20 years later. That transition of new doctor to a 20-year provider has value to it. There's things that I've seen. And I go through this with my associates because they're staggered throughout that time frame. Okay, a 2-year and an 8-year. So 1 year to 2 years, 2 years to 8 years, 8 years to 20, there's a pathway. And as you gain an experience, after all, they call it going into practice, right? Not going into knowing. So we're going to learn as we go, and we're going to get better as we go. So that's the first component of evidence-based healthcare, is the provider's experience. And that clinical experience is 1/3 of this process. The second component is the patient's experience and expectations. So chiropractic historically has had the highest level of patient satisfaction ratings out of any health profession. And that's something that we've been able to maintain for 120 years. And we're good at that because we're good communicators with patients. But what the patient expects when they come into our practice, what they want out of their care, how they're satisfied is also an important component of evidence-based care. And that's actually a third as well. So we have the doctor's experience and we have patient expectations and satisfaction. That's 2/3 of evidence-based care. Chiropractic has been very, very good at those 2 aspects of care. The third aspect of care is external evidence. And to you and I and the rest of the world, what that means is published research. And when we talk about published research, we go all the way from a single case study, which means that I had a patient A that came in with this. This is what I found. This is what I did. This is how the patient benefited. And now I write it up as a single case study. Once the case studies start to pile up, and there was 1, and now there's 5, and now there's 20, and now there's 100, those case studies can be put together, and now we want to measure a group. We want to take a cohort, and we want to look at what's going to happen to them because it's more heterogeneous, right? Which means that there's a mix of people, there's a mix of races, there's a mix of ages. So those are things then that result in more of a cohort type of study, and the evolution goes on and on, all the way to the point where there's enough research backing everything that we have a systematic review. And a systematic review is the type of research that goes back and reviews every large study and looks at all of the outcomes, looks at whether it was actually a well-designed study or not, and writes 1 paper on all of that information. So sometimes those are like the cliff notes of research. And that's important, but it's only valuable if those topics that the systematic review is looking at are well researched to begin with. So a lot of the spine, particularly the mechanical spine pain stuff, in the systematic reviews, you'll say more research is needed. And that's true, because we're just getting the clinical aspect of biomechanical spine care going. right? Because you remember Dr. Punjabi and Dr. White, those were the laboratory guys that studied spinal biomechanics. And they published and published and published. So laboratory-based spinal biomechanics has been very well established. And, I don't want to say the book was closed on it because we're moving into other frontiers like sagittal balance and coupling motions and things like that. But as far as understanding how the spine works, that really sort of peaked in the late 80s and the early 90s. Now our job is to translate that science into clinical practice. And that's where the research is going, and I'm going to talk about that in some other videos. So when it comes to external evidence, we're talking about research. So we have clinical experience of the doctor, patient expectations and satisfaction, and then third, we have the external evidence or the research. If you look at what's happening historically in our country and where policy is being driven, it's designed to kind of take away 2/3 of the value of evidence-based medicine and put it solely on the back of research. Okay? And what most people say when they say evidence-based, it means that I follow what a research paper said. And that's not the proper way to do it. That's not being a good clinician, because you're only acknowledging 1/3 of evidence-based. So when it comes to evidence-based, again, understand that there's a triad. And when those three things come together, that's our evidence-based paradigm. Your clinical experience, the patient's satisfaction and expectation, and what does the research say. You need all three of those to guide you. So I look forward to having more conversations with you. So thank you so much for joining me. And if you have any more questions or concerns, just email me below, and I'd be more than happy to have a conversation with you. Have a great day.